So I was a family doc. I opened up my practice in 1982, about an hour north of Boston, and I was very happy as a family doctor. I became chair of family medicine at Lahey Clinic, and I was teaching at Harvard Medical School, and really quite happy being in the community and part of the community. I had done a Robert Wood Johnson Fellowship at the end of my residency, and I had learned research design, statistics, and epidemiology with the idea of having the option to go into an academic career, but had decided that I really liked taking care of people in the community. So that's what I was doing, and I was doing it happily. But as the late 90s approached, it became clear that the drug companies were having a greater and greater influence on what doctors thought the right way to treat their patients was. The first example was hormone replacement therapy, with the idea that all postmenopausal women should, without a contraindication, should take hormone replacement therapy, even as the evidence grew that hormone replacement therapy increased the risk of breast cancer. And yet the drug companies, even my colleagues, were going to continuing medical education courses that continued to advocate the use of hormone replacement therapy for postmenopausal women. And then Vioxx came along. Vioxx was an arthritis drug that doesn't provide any better relief for arthritis pain or other kinds of pain, but ostensibly decreased the risk of serious GI bleeds. And I got into the FDA data, which was very hard to get into, but once you're there, there's a treasure trove of information. And what the FDA data clearly showed was that Vioxx was a dangerous drug and more than doubled the risk of serious cardiovascular complications compared to routine arthritis drugs. And what had happened is the New England Journal of Medicine had published Merck's big study that claimed to show that Vioxx was a safer drug than the other anti-inflammatory drugs. And yet, in black and white, the FDA was saying, no, this is wrong. This is a more dangerous drug. And I was continuing to practice at that point. Vioxx was the most heavily marketed drug to consumers. My patients were coming in demanding Vioxx because that was the latest and best therapy. And the disparity between what the New England Journal and the drug advertising was convincing doctors and patients of, on the one hand, and the truth about this, which is that it was a deadly drug and probably ended up killing between 40 and 60,000 Americans. That disparity was just too much. And at that point, I decided I was going to leave my practice and write a book about the drug company's influence. That book was published in 2004. It was Overdosed America.
So can you explain for the audience why the FDA would have a disparate level of information, or why there would be a different conclusion reached with the FDA data as opposed to the New England Journal?
Yeah, great question. So the drug companies are supposed to turn over all their data to the FDA and the FDA evaluates that. Now, that didn't quite work out, and we can talk about that if you want to. But the key point here is that the New England Journal published this peer-reviewed article that concluded that Vioxx was a safer drug than older anti-inflammatory drugs. Now, why did the FDA got it right? Because they had most of the data. The really important question here is, why did the New England Journal get it so wrong? And that exposes a lot of the problems in American medicine and what doctors know about how to practice. The issue is that the New England Journal, which is the most respected journal in the United States and probably the world, is a peer-reviewed journal. When a manufacturer or when a clinical trial results are submitted to the New England Journal, they go through peer review, and the peer reviewers ostensibly look at the data, look at the article, and make sure that the article presents a reasonably accurate and complete telling of what happened in the study. The truth is, and this is a truth that almost no doctors know, the truth is that the peer reviewers don't have access to the clinical trial data. They only get access to the summary of the data that's included in the submitted manuscript. And they don't have the actual data. There's no way the peer reviewers can vet that and certify that it's accurate and complete. So what happened is the article was false and misrepresenting the facts, because Merck had eliminated 3 of the heart attacks that occurred in people taking Vioxx. Now you might say, well, gee, the authors should have picked it up and the peer reviewers should have picked it up. But there were 13 authors, 3 of whom were Merck employees, 8 of whom, 9, 10, 11, in any event, 3 were Merck employees and the rest were academics. And the academic physicians who were authors of this article didn't know about the excess heart attacks that hadn't been reported. And the FDA knew about them and said they didn't accept the analysis based on not counting those 3 heart attacks. But the FDA takes a firm stand that they do not take any action to correct a journal article that they know is wrong.
I just want to emphasize this for the audience, because that is just such an incredible piece of information that I was unaware of, that these summaries that are given to journals like this, and then they can be categorized as peer review. I mean, those can be heavily influenced by the pharmaceutical industry and the drug manufacturers. In this instance, it was like, how common is this practice when you look at the way that drugs are analyzed by journals like this throughout the country?
It's universal. There's no peer review that demands access to the clinical trial data. And it gets even worse, Emma, because there's an enormous conflict of interest for the journals not to create better standards for peer review, because the New England Journal sold almost 900,000 reprints to Merck for a profit that Merck then handed out to physicians, showing that the New England Journal said this was a great drug. So the New England Journal has a conflict of interest. They sell these 900,000 reprints back to Merck. They take in somewhere around $600,000 or $700,000 in revenues. And Merck has the New England Journal has a real incentive not to throw a wrench in this process where Merck had misrepresented the results of its data. And again, this is not an academic issue. 40 to 60,000 Americans died from the cardiovascular consequences, heart attacks, blood clots, and strokes from Vioxx, and their doctors didn't know that Vioxx doubled the risk.
That is just incredible that there is this greasing of the wheels with these journals, which are, I mean, look, I would say a science noob, but it's hard for me to sometimes digest some of this information and get it fully. But I knew the New England Journal of Medicine. I've heard of this. I totally thought that their word was something that you could fall back on. And like, frankly, from reading, parts of your book about this, like, that your response to Vioxx and the response from the New England Journal to your criticism of them was shocking in its vitriol. Can you talk a bit about that?
I sure can. This is in chapter 1 of my recent book, Sickening. Vioxx got pulled from the market a week after my book came out, Overdosed America, back in 2004. And I was the guy who wrote the last book, and so I was all over the Today Show and the big TV shows and got a whole lot of media coverage. So the medical students at Harvard, where I was teaching, this got on their radar screen, that this was a big issue, the biggest drug recall in U.S. history. And they asked me to give a lunchtime lecture. These are optional lectures where there's a pretty good lunch provided, and students can come in and hear about a given topic that's being presented. So the students asked me to give a lunchtime lecture on the Vioxx story. And I did. And I told basically this a little bit more detail, but the story that I just told you, that Merck had not supplied the New England Journal with the full information from the study, that peer review doesn't get the real data, and the editors hadn't gotten the real data, and that somewhere a total of 40 to 60,000 Americans died because of this. It's probably somewhere around 30 to 50,000 who died after the New England Journal knew that their article was wrong. So I said this straight up, just quoting the facts. A lot of the facts came from the Wall Street Journal. At that point, the Wall Street Journal was very interested in pharmaceutical issues, and I worked with their writers, and they wrote it up, and they added some information that I didn't have, and that was fine. And then maybe a few weeks later, I got a call out of the blue from the New England Journal of Medicine's editor-in-chief's administrative assistant, who said to me, "We know you're going to be giving a continuing medical education lecture in a week or two, whatever. And Dr. Drazen, the editor-in-chief of the New England Journal, will see you in his office at 11 a.m. And I got a little testy and said, well, I like to talk to the people at the lecture, so let's make it 11:30. So we agreed on 11:30. So I had no idea what Dr. Drazen had to say to me. I was hoping he had to say that we made an error and we'd like you to write a piece that describes what happens so we can clear the air here and get back on track. He said nothing of the sort. He said to me, how do you think I feel when I'm making rounds with Harvard medical students and they tell me you're criticizing an article in the New England Journal? And I said, well, I can't read your mind. I don't know how it makes you feel, but my impression is that your job as a medical journal editor is to make sure that the truth, in whatever form and the best way possible at the time, that you make the truth available to American physicians so they can practice the best medicine. Well, he evidently disagreed with that idea, and he thought I should just cease and desist from talking about the New England Journal's role in continuing to support Vioxx even after they knew the story, and the FDA even had understood the story at that point. And the New England Journal kept selling reprints, and he thought I should back off. He didn't say this is bad for our business, but you can read between the lines. And that just shocked me, that the New England Journal, that virtually all physicians think what you think, Emma, that this is the highest source of authority in American medicine. And whatever is published in there, we can believe. And what I found out at that point was that the New England Journal, although a nonprofit organization owned by the Massachusetts Medical Society, that the New England Journal was in this money game, just like the drug industry is, just like academic researchers who are working for the drug industry are, and that there's this nexus of influence that creates the illusion that the innovation in American medicine is great for Americans and they ought to be happy to pay up for it. When in fact, our health is losing ground to the other countries in the world very rapidly while we spend so much more extra money.